Hi, Dr. Tyler Dickenson here with St. John's Chiropractic Clinic, and I want to go over our upper cross exercises and stretches. The first stretch that we're going to do is for our upper trap muscle. We're going to take our arm behind our back. That's going to help stabilize our scapula, shoulder blade, and then we're going to take our hand, our other hand, to that side of our head and allow our head to gently fall away from the arm behind your back. You'll feel that stretch on the side of your neck and into your upper trap. With all exercises and stretches that we're doing here, you need to do it gently. Make sure that you're not getting any pain. It should be completely pain-free. If you get any numbness, tingling, or pain down your arm, you need to stop immediately and talk to your doctor about it. The next exercise we're going to do is very similar to the upper trap stretch. You're going to take your arm again behind your back, and then instead of your hand going to the direct side of your head, you're going to go to the back corner of your head. Turn to look away from the arm that's behind your back, and then gently pull your head kind of down so your chin's going towards your chest. You're looking down at your shoe or your pocket area, okay? You'll do everything both sides, so upper trap stretch and the levator scap stretch on both sides, and then we're going to move on to our pec stretch. For this, you're going to find a doorway or a corner, and then you're going to put your arms out, about shoulder height, a little higher, a little lower. You can play around with what feels best for you, or you could do multiple levels to really thoroughly stretch your chest. So you'll find your corner or your doorway, and you're going to put your arms up. From here, you're going to make sure that you pinch your shoulder blades together as you move your body into the corner or through the doorway, okay? And it's important that you're pinching your shoulder blades together because what we're doing is trying to correct a rounded posture. So patients will sometimes say when they're doing this incorrectly is, man, I feel in my shoulder a lot, in the front of my shoulder rather than in my chest. Well, what's happening is you're rounded, and as you're trying to attempt to do this, you're not opening up your chest. So yeah, you are going to feel it in your shoulder. That's not what we want. You need to, if that is you and you're feeling your shoulder, you really need to make sure that you're pinching your shoulder blades together, lengthening your chest muscles, and then you're going to feel it where we want it to, and it's going to do its job, okay? The next exercise that we're going to do is some strengthening work for the muscles between our shoulder blades. The first one is going to be an isometric row. So what we'll do is you're going to drive your elbows back, behind your back, okay? Your elbows are going to go against the wall, and you're pinching your shoulder blades together as you walk away a few inches. Make sure that your head is stacked on top of your spine, that it's not jutting forward. And then from here, you're just squeezing your shoulder blades together, pushing your elbows into the wall, and you're holding yourself up with the muscles between your shoulder blades. And that's going to help strengthen them. The next exercises are T's and Y's, okay? So what you're going to do, you'll be laying face down for this exercise. I'm going to demonstrate it as if the wall were the floor, okay? So you're going to get into a T position, pretending this is the floor, face down. You're going to point your thumbs towards the ceiling, okay? And then you're going to pinch your shoulder blades together to raise your arms up off the ground a few inches. Okay, you're going to hold that squeeze for a few seconds, down, and then again, okay? That's the T. A Y is a progression of that. It's harder, okay? So if you're not ready for it, feel free to, wait a couple days, a couple weeks, whatever you need. But eventually you're going to work up to where you can put your arms up at about 45-degree angles from there. And then you're going to do the same thing. Pinch your shoulder blades together and raise your arms up off the ground a few inches. Okay, both T's and Y's, same mistake people can make is, you're rounded and you're moving your shoulder a little, your arms a little bit, but it's coming from your shoulder joint, okay? It's important that you're moving your shoulder blades when you're doing these exercises because that is what's gonna correct the rounded posture that we have, okay? The last exercise is to strengthen your deep neck flexors. So for this one, real simple, you're gonna put your butt and your back against the wall, and all you're gonna do is take your head straight backward, okay? Straight backward. Not looking up, not looking down, just straight back, essentially giving yourself a double chin and pushing the back of your head gently into the wall, okay? So that's stacking your spine on top of itself, lengthening your spine, strengthening your deep neck flexors. These are our upper cross stretches and exercises. If you have any questions, be sure to ask your doctor. Thanks a lot.